Hi, everyone. Welcome back. My name is Dr. Samantha, and I am the maternity mentor. And welcome to another live Q&A. For everybody who's joining us, please remember you can go ahead and put any comments you have in the chat. And let's get started. I just want to remind you, we are posting videos every week. We have a new video going live tomorrow on preeclampsia. So let's get going. All right, hold on one second. Hi guys, sorry, I got a notice that my sound was a little off, so I went ahead and I switched to headphones. Welcome everyone. Again, Dr. Samantha here for another live Q&A. And this is where we take our time to answer questions that viewers have put in on the channel over the week. And we also take your questions live. So before we get going, just remember, if you have any questions, please feel free to put them in the chat. Welcome everyone. So I see we actually already have a question in the chat. So I'm going to go ahead and do that one first. Thank you for joining me. How do you deal with painful hemorrhoids that interfere with everything at 30 weeks? Okay. So this is a great question to answer. So hemorrhoids are extremely common during pregnancy. And what a hemorrhoid is it's a blood vessel that has actually become dilated or opened up, and it kind of sticks out. It's usually sticking out of the anus, although you can have them internally as well. And these can become swollen and painful. So luckily, during pregnancy, most of the treatments that you see over the counter can be used during pregnancy. So the one I recommend the most is witch hazel pads. And witch hazel pads, the brand name is Tux, but you can actually just buy witch hazel and put it on cotton pads. Witch hazel is very soothing, and it's known to help shrink swollen tissue. So you want to go ahead and you apply it as much as you want to the actual anus and let it just sit there and soothe. Another thing that you can use is some of the hemorrhoid creams like Preparation H. A lot of those have a very mild steroid that will help to shrink the tissue. And another common thing is to use a little bit of ice, but ice you have to be careful with, because what people don't realize is a little bit of cold ice on skin can actually burn it. So you can only put on like a cold compress. So you can take some ice and wrap it in a cloth and lay it against the anus. And that can help to shrink the tissue, but it can also help to numb that tissue, which can help with pain. All right. So those are some of the things that you can do. Now, there are some over-the-counter products like suppositories. Those I would avoid without talking to your healthcare provider first. So while the little creams do go internal, they have an applicator, and it's a tiny little piece that goes inside the anus. With a suppository, you really have to insert that medicine up inside. And you want to be careful because you don't want to cause any kind of tearing, which could lead to infection. Okay. Now, unfortunately, hemorrhoids do not just go away. The only way really to get rid of a hemorrhoid permanently is to have surgery. And most women are not eligible for surgery during their pregnancy. This is something that you have to wait until after pregnancy to deal with. Women are often worried, are they going to be able to have a vaginal birth with hemorrhoids? And the answer is yes. You can usually have a vaginal birth even though you have hemorrhoids. The biggest risk factor to a vaginal birth if you have hemorrhoids is if you were actively bleeding from your hemorrhoids. In that case, they may or may not decide to let you have your vaginal birth. I hope that answered your question. All right, let's go to one of the questions that we got from one of our viewers. I'm 24 weeks pregnant and I have some white and brown discharge. The gynecologist prescribed azithromycin and metronidazole. Is this safe for my baby and me to take? So, metronidazole and azithromycin are two different types of antibiotics. So, both of those medications are safe for use during pregnancy. One of the biggest things when taking antibiotics is you need to finish all of the antibiotics. Take everything the doctor has prescribed. One of the things that's very tempting is for us to take an antibiotic until we feel better and then stop taking it because we're worried about the baby. Infection can lead to preterm labor, miscarriage, a baby that's small for gestational age, or it can even lead to maternal death. So you need to make sure that you take your medication as prescribed. Now, for some women, you may live in areas where you don't always have access to your healthcare provider regularly. Another person you can ask to check on this stuff is your local pharmacist. Pharmacists have a lot of training and medications for pregnant women, and they can also help to answer your questions. Now, in this case, this mom has been prescribed two different antibiotics, and you may be asking yourself why. She describes white and brown discharge. So, brown discharge is often the sign of bleeding, and bleeding can be caused by a variety of things, including infection. White discharge can be caused by different types of infections. So, it's probably likely that this mom may have one or two different infections going on, and her doctor is trying to treat both at the same time. If you've been prescribed two antibiotics, it is also very important that you take both. Not every antibiotic kills every bacteria. In fact, a lot of them are very specific. A very common example of this is macrobid. Macrobid is an antibiotic that's almost exclusively used for urinary tract infections. So if you were getting, say, penicillin and macrobid, again, these would probably be treating two different infections and you'd want to be taking both. All right. Next question. Hi, I delivered my baby 8 days ago and I'm experiencing bleeding when I accidentally force my body, but it stops quickly. Is this normal? So, postpartum bleeding. So, after you give birth, whether it's by C-section or vaginal delivery, you are going to bleed, and you will bleed pretty heavy for the first 1 to 3 hours. This is why you're monitored very carefully by staff to make sure the bleeding is under control. When the placenta, which is what feeds the baby, detaches from the uterine wall, there's a whole bunch of exposed blood vessels here. And what happens is the uterus starts to contract back down, and you feel that. And they will also give you medicine called Pitocin to help that process. And it clamps down on those blood vessels, allowing them to clot off and to stop bleeding. Well, if something happens that stops this process, you'll continue to bleed out, and then other interventions are needed. So after the first 1 to 3 hours, the bleeding turns into what looks like a heavy menstrual cycle. Okay. And it's very normal for you to have this heavy menstrual cycle for up to a week after delivery. Now, a heavy menstrual cycle may include teeny tiny clots, but nothing bigger than a quarter. And you will bleed a lot in a pad, but you shouldn't be soaking through a pad in 30 to 40 minutes. That's too much bleeding, and your healthcare provider needs to be made aware. After about a week, the bleeding will start to lessen and lessen, and most women will stop bleeding by 6 weeks postpartum. And bleeding will go from bright red to a darker red to a dark pink to a light pink to like a white discharge to a clear and then nothing. Okay. At 8 days postpartum, when she says, I accidentally force my body and I see bleeding, but it stops quickly, what that sounds like to me is maybe she's sneezing and she sees some blood come out. If it is bright red blood and just a couple days before her blood had turned to pink, then that's not normal and you need to contact your healthcare provider. The progression of color should not go backwards. If you're at pink and you go to bright red, that's something your healthcare provider needs to be aware of. However, at 8 days, if sudden movements give you a little gush of blood, that could be considered normal. Now, other signs that your bleeding may not be normal and you need to let your healthcare provider know: if you are feeling dizzy or tired, or you're vomiting, or your stomach is really hard like a rock. Those are things that you want to let your healthcare provider know, especially if you're still bleeding heavy. Additionally, if you were to get an infection, you want to let your healthcare provider know. And finally, at 8 days postpartum, actually like 7 to 10 days postpartum, if you are still having heavy bleeding and your milk supply has not come in, you want to contact your healthcare provider immediately. So one potential cause of the delay in milk production is when a tiny piece of the placenta stays inside the uterine wall. When this happens, the hormones that are needed to make milk don't get released, because those don't start to be released until all of the placenta is out of your body. So if a teeny tiny piece stays in there, your production will not start. So if you're still bleeding heavy at like 7 to 10 days and your milk hasn't come in, you want to call your healthcare provider, because they may need to go in and examine you for a piece of the placenta. All right. So thank you so much. I see. And is it hemorrhoids or sciatica if you feel like a knife is up your anal region the whole time with extreme pain and itching? Don't worry about the questions, please. It's okay. So, and I see this other one just came in. I'm sorry. Had the incision and drainage only for it to come back, and Proctofoam. Proctofoam's really good. For anybody who doesn't know, Proctofoam RX is like a foam medication that goes up there that has like a steroid and some soothing medication. Okay. So the vaginal delivery, she was also asking what I'd said about vaginal delivery. You can have a vaginal delivery most of the time when you have hemorrhoids. The only reason why hemorrhoids might prevent a vaginal delivery is if the hemorrhoids have gotten so bad that they've torn and you actually have a tear near the sphincter and it's actively bleeding. Because as you push, you do put pressure on that whole area. So if there's an active tear, they may or may not allow for a vaginal birth, because that could increase the risk of you actually getting a 4th degree perineal tear. And we actually have a video on vaginal tears during delivery, lacerations and stuff, and we'll put a link up in the chat. Now, hemorrhoids or sciatica. Now, this is a good question. Knife up the anal region the whole time with extreme pain and itching. So this is a tricky one. Itching is definitely not sciatica. That is hemorrhoids. So hemorrhoids, that whole region is kind of prone to having a lot of our waste. And when I mean waste, like it's in the blood too. And if it sits there and pools in some of those like dilated veins, that can cause some itching. So itching is usually always hemorrhoids. The knife pain, it's hard to say. Sciatica usually comes from the lower back and travels down through the hips and shoots into the legs. But I would tell you that knife pain sounds like a nerve pain, so it is possible that it is coming from that. Okay? Next question. I'm 22 weeks and 2 days and experience light spotting for 1 day. I'm scared because it's my first pregnancy. I'm out of town, so sadly I can't visit my OB to get it checked. Should I go to the hospital to get it checked? The answer is yes. And I actually responded to this video and said yes prior to the live to make sure this person knew that. So 22 weeks pregnant is very close to what we call viability. Now, whenever you see bleeding in pregnancy, whether you're 1 week pregnant or 39 weeks pregnant, you should always contact your healthcare provider. That's extremely important. Bleeding is not normal during pregnancy, except during active labor. And during active labor, it should be monitored by a healthcare provider. Up until that point, you don't want to see any blood of any kind. Now, at 22 weeks, we have a baby that is on the cusp of being able to live outside of mom's belly. That's what we call viability. Viability is the moment that a baby can live without the placenta and the umbilical cord. So it's usually about 23 weeks, but at 22 weeks, if a mom was put into the hospital, she can receive medications to help mature the baby's lungs, to help protect the baby's brain, so that if a delivery does happen, we might be able to help the baby survive. Now, the thing is that this highlights a very interesting point. Mom says she was out of town. There's a lot of different reasons why we have to travel. And if you have to travel for work, you have to travel for an emergency, that's understandable. But a lot of women choose to travel after they've reached this moment, basically in the middle of their second trimester, for, entertainment purposes. And what I will tell you from my experience in the hospital is I have taken care of more women who are from another country or another state because they were traveling into our area for a little entertainment trip or a vacation, and they got stuck because they went into preterm labor. So when you're on vacation, you are not eating the way you normally eat. You are not drinking the way you normally drink. You are not sleeping the way you normally sleep. And this puts a lot of stress on your body. Additionally, most people out on vacation, what are they doing? They're trying new things. They're doing new things, and they are kind of pushing their body because they want to do all this stuff. They're only going to be in this place for a short period of time. So you want to make sure you're checking in with your healthcare provider before you just go on a trip, because these trips can be very hard for you and they can stimulate preterm labor. Also, a lot of people go on what's called baby moons. These are almost like a little honeymoon right before baby gets born, where couples get a chance to connect, which is awesome. Part of this connection is usually a lot of sex. Sex, if done hopefully right, includes orgasms for mom. And sex and orgasms can also cause uterine contractions. And if you've got some stuff going on that might predispose you to preterm labor, that can stimulate it. So you want to be really careful when you are traveling out of town. To go back to this, if you are like this mom, 22 weeks, 2 days, she's bleeding, she's out of town, go to an emergency room. Period. End of conversation. That's what you need to do. Even if you called your healthcare provider, there's no way for them to really monitor you very carefully from afar. The best thing is to get checked out in a local hospital. All right, next question. I have a cerclage from week 19. I am now at week 26. My cervix is open in a V shape, right to the stitch. How long can a cerclage last, and how can it fall off? Okay, so this is a great question. So cerclage is a stitch in the cervix. So let's see what we mean by all this. Okay, you've got the uterus. That's where baby is. At the bottom of the uterus is the opening to the vagina. Okay, and that is the cervix. Okay, the cervix should be closed. Okay, it should be long and it should be thick. Okay, and when it's time to have the baby, this cervix dilates open. Okay, a cerclage is a stitch that goes around the bottom to help keep this closed. So it kind of circles around and it'll even go through. And it's designed to prevent the cervix from opening up. Okay, because when it opens up, that means the baby can come. And at 22 weeks, 24 weeks, 26 weeks, a cervix does not need to be 10 centimeters for you to deliver the baby. In fact, a lot of women can deliver their babies with a cervix open to only 5 centimeters, which is why we will use things like a cerclage to prevent that preterm labor. Okay, so she has a cerclage in place. It's at the base of her cervix. It's a stitch, just like you'd imagine in clothing. It's made with thread and a needle, okay? She's describing that her cervix is now a V. So her cervix is wide open at the top and it's closed here at the bottom by that cerclage. So how long can the cerclage stay in place? If the cervix remains closed, the cerclage can be there right up until the end of your pregnancy. I have been in the room when doctors have come in to remove cerclages at 39 weeks so that a mom can go ahead and have a baby. Usually the cerclage will be removed around 37 to 39 weeks. It depends on the provider. How do they remove it? Again, the cerclage is thread. This is not dissolvable thread like you get in a surgery. This thread needs to be removed. So what they do is they snip a little piece of it and then they just pull it out with like a little pair of tweezers, sterile tweezers. Okay? If your cervix is like this mom is describing, where she's now like this, and all that's holding it closed at the bottom is that cerclage, that stitch, most likely they're going to remove that stitch very soon. Probably this mom is being monitored inside a hospital, and the baby's being monitored, and they're probably giving her medications like antibiotics and steroids for the baby to mature the lungs and stuff to get ready. But the risk is, if the cervix keeps dilating and rips that stitch, it can cause a cervical laceration. A laceration is a very bad cut. That laceration can cause a hemorrhage. We actually have a video on postpartum hemorrhages, so you can look up what that looks like. We'll put a link in the chat. And while it's slightly different, the idea is the same. It's a hemorrhage and you can bleed out, and there may be life-saving treatment that's needed. So by the time your cervix starts to do this with a cerclage at the bottom, they're most likely going to be removing it soon. And it's just a snip, and then they take it out. And then most likely you'll dilate very quickly and you'll deliver the baby pretty soon after that stitch has been removed. For any of you joining us, thank you so much. Welcome to our live Q&A. Please feel free to put any questions that you have into the chat. Okay, our next one has to do with dental treatment, which I love. I had an extraction due to severe pain from a bacterial infection under my tooth. I was 10 weeks, 6 days. Should I be concerned? I'm a bit worried that extractions shouldn't have been done in the first trimester. So this is a great question. Lots of moms are great about getting all the right health care they need when they find out they're pregnant, but then they neglect their teeth. So hopefully this mom is listening. That was the exact right decision. So research has shown us now that if you don't get good dental care throughout your pregnancy, including the first trimester, this can actually lead to adverse outcomes and long-term health issues for your baby, okay? Bacterial infections can affect blood flow and placental function. So you want to make sure that you're getting good care. And if you have a bacterial infection that would cause you to need an extraction, that's where they take out the tooth, then you should have that done, whether you're in the first trimester, second, third, or postpartum. The only difference is you may require an antibiotic after this procedure. They just may choose to use different antibiotics than they might use with everybody else. And the second thing is they may limit the number of x-rays you get in order to determine what they're going to do for your dental care. Now, that being said, you can get x-rays during your pregnancy. A lot of people get very nervous about this because we've heard, x-rays can cause damage to a growing fetus. And this is true, but today's x-rays have far less radiation than what they used to 20 or 30 years ago. Additionally, if you need to get an x-ray of your tooth, which is up here, that x-ray is going to have a tiny bit of radiation that's very focused up here. The person who's doing the x-ray is going to give you the lead shield that will cover your thyroid, which is in here in your neck, all the way down, including your baby. They oftentimes, if they know you're pregnant, will do a double shield around the abdomen. So 2 lead shields instead of 1. So this is a way for you to safely get that x-ray if needed. However, a lot of dentists are able to go ahead and diagnose you without the x-rays if they know you are pregnant. Okay? All right, next question. What care can a midwife give to a woman and her baby during those times? So this question was asked off of our diabetes question. So when you get diagnosed with diabetes during pregnancy, you have a lot of stuff going on now. Diabetes puts you at risk for having a large for gestational age baby. This is a baby that grows much faster than the regular baby. And we think that sounds good, but that's actually not good at all because the baby is growing so fast because it's eating up all the sugar that extra sugar that you have from the diabetes that's not being utilized properly. And so what happens is when that baby is born, first of all, a lot of times mom needs a C-section because the baby gets too big for her to have a vaginal delivery. And then when she delivers the baby is oftentimes having sugar withdrawal, which requires intensive care in the neonatal ICU. So it's not a good thing to have diabetes during your pregnancy. So a lot of these moms will end up being referred to a maternal fetal medicine physician who is a doctor who specializes in complications during pregnancy, including diabetes. However, you still need your regular care. Regular prenatal care continues even if you're seeing specialists. So you still need to go in the second trimester every 2 to 4 weeks, depending on where you're at. Once you get to the third trimester, late third trimester, you need to go every week. You're going to need to potentially have vaginal exams at the end. You still need your GBS swab at 36 weeks. For those of you who don't know what GBS is, we have a video on that. We'll link that in the description below. But that GBS swab will be done later on. You still need all the counseling and everything else that your midwife would normally do. Then you still may be able to have a vaginal birth. Just because you have diabetes does not mean your midwife cannot potentially deliver your baby. Now, one thing I will tell you is if you were planning a midwife birth in a birthing center, that you will most likely be told don't do that. And I would agree with that because like I said, there's a lot of complications that can happen for baby if you have diabetes. And in fact, I would be looking around and asking if your local hospital where you might deliver has a level 1 NICU. If it does have a level 1 NICU, that's fantastic because oftentimes these big babies of a gestational diabetic mom will need intensive care. All right, next question. During my second delivery, my cervix only dilated 5 centimeters after 9 hours of pill induction. Within 5 minutes, it went to 10 centimeters dilated, and I pushed in 10 minutes. It felt way too fast. The first pregnancy was very different from the second one. It took 13 hours to dilate to 10 centimeters. All right, so 5 to 10 centimeters in 5 minutes is actually more common than you think. So again, uterus, this is the cervix. This is the opening to the vagina. It starts out closed and eventually it dilates to 10 centimeters, allowing baby to come down. Okay. So the first 5 to 6 centimeters are the longest. In fact, if you look at a mom who say is in labor for 18 hours, sometimes a good 16 of those hours are just 0 to 5 to 6 centimeters. Once you get past 5 to 6 centimeters, things can go very quickly. And your body, when you're on your second baby, it remembers what you're doing. And so once it gets past that kind of bridge, it will just go into action. Now, what did happen for her is she had what's called a rapid descent. That's where the baby just all of a sudden went, boom, okay? And unfortunately, that can be very painful and it can lead to cervical lacerations. It can lead to excessive bleeding. It can lead to complications for both mom and baby. So that's why it did feel so uncomfortable for her. What I will tell you is that it's not necessarily the sign that something went wrong. It's just how your body reacted during that pregnancy. Now, the other thing I want to mention that she mentioned in her question was she had a pill induction. So what does that mean? So there's basically a couple different types of inductions. There is a pill induction. So that's where they take a medication that can cause some cervical ripening and it can also cause some contractions and they put it up inside the tip of the cervix. So this is the vagina. They insert a little applicator in through your vagina and kind of stick this little tablet up in there. Okay. The next one is kind of like a sponge and it's usually called Cervidil where we're at. And it's it's like a flat piece of cloth that has a little tail, kind of like a tampon. And that piece of cloth has the medication in it. So they take this, they put it up in the vagina, and they put it next to the cervix. And that helps to ripen the cervix and get it ready for delivery. And then the last one is usually Pitocin, which is an IV medication that causes contractions. And what contractions do is the uterus, it like expands and contracts like this. And as it's doing that, remember our uterus is here, it pulls at the cervix. And so over time, that cervix starts to stay open and open and open and open. And that's how a Pitocin induction works, okay? That's a great question. And for any of you who've just joined us, I'm Dr. Samantha, the maternity mentor. We're here answering your questions live. So please feel free to put anything in the chat if you have any questions or anything you want to talk about. All right. So next question is about itching. I'm 8 months pregnant and I've been experiencing itching all over my body for 2 days. I can't even sleep at night because of the itching. Please help. I'm very scared. So this mom is very likely experiencing cholestasis of pregnancy. And cholestasis of pregnancy can actually be a serious condition. What it is it's a liver problem. And what you need to know is your liver processes toxins in your body. So when your liver isn't working right, what happens is those toxins build up and they'll seep into your tissues, and that will cause itching. Okay. And this happens usually because the bile duct, which is part of that system, the gallbladder produces bile, and it's like a little organ, and it has a tube attached to it. And the tube is supposed to release that bile into your stomach, and it helps you to digest your food and stuff. When that's not working, that's what causes this issue. Cholestasis of pregnancy can end up being life-threatening. So a lot of moms will be induced at 37 weeks of pregnancy if they've been diagnosed with it. Now, what can you do? Because it feels horrible. So you need to talk to your healthcare provider, of course. Some things that may or may not work a little bit. Some providers will let you take some allergy medication like Benadryl. Again, this is not an allergy, but allergy medications do sometimes help with itching. So sometimes it can provide a little bit of relief. Okay. You can also try oatmeal baths. So oatmeal is very soothing on the skin, and sometimes soaking in an oatmeal bath for a little while is very good. However, you cannot soak in hot water if you are pregnant. That is not good for you and it can actually trigger labor. So you want to make sure the water is warm but not too hot, okay? Hydrocortisone cream, which is a topical kind of over-the-counter steroid cream, may also be able to be used. Unfortunately, steroids are the recommended treatment, but steroids aren't safe for pregnancy for long-term use. Most moms with cholestasis of pregnancy have to kind of muddle through it until they get to about 37 weeks and they can be delivered. Your healthcare provider will be monitoring you carefully. You'll probably have regular blood work, and they may even send you to that specialist that I talked about before, the maternal fetal medicine specialist, to monitor the pregnancy in case any complications develop. Then they may go ahead and they may deliver you. All right, so I have another question about preterm birth. I'm currently 27 weeks pregnant, and the doctor discovered I have a short cervix of 2.2 centimeters at 26 weeks. I'm currently on progesterone. I'm so scared of having my baby early. Do you think progesterone will help prevent preterm labor? So this is a great question. So let's start with the terminology. So she says she has a short cervix. So uterus, vaginal opening, cervix. So we want our cervix to be long. Okay. This is like your two fingers together is a really good representation of your cervix. And so we want it long and thick, and we want it closed. Now, when she says she has a short cervix, this means that her cervical length is lower. So in her case, it's 2.2 centimeters. So it's probably like this. Okay. So how does this, if this is normal, how does this change once you are giving birth. So what happens is as you have the contractions and your cervix is opening up, it basically like opens and thins out like this so that the baby can come down and come through. A short cervix means that probably some of that has started to happen. So it's like it was like this and it's kind of like this. Okay? That's what's happened. So, progesterone is a hormone that's often used to help prevent labor and to keep a pregnancy going. That hormone is needed for a healthy pregnancy. And the thought behind it is that maybe there's some contractions and stuff that may be causing this. We can have contractions that are silent contractions. You don't feel them, that nothing hurts, they're just there. And so as a result, this may be happening and they're giving progesterone. Do I think that could help? Absolutely, I think that could help. Now, what other things might help you to prevent preterm labor? So, a very common thing that you can do to help prevent preterm labor is drink plenty of fluids. Okay. Dehydration is one of the most common causes of preterm labor in women. Also, you want to rest. Now, rest does not mean bed rest. Okay. And we have a video on bed rest that we can link for you. But bed rest is not always safe for a woman because bed rest can lead to other complications, including pneumonia and blood clots. But rest can include you asking for help. We need to ask our village, our family, our friends to help us out, our coworkers even. You shouldn't be lifting heavy things. You want to make sure that you're taking plenty of breaks. You want to make sure you're having a good time. Rest does not only include like the physical stuff, it also includes emotional, it includes sleep. Taking good care of yourself can help prevent preterm labor. Unfortunately, when a mom is experiencing complications during her pregnancy, it's very stressful. And that stress releases hormones like cortisol and epinephrine, which are actually not very good for your baby. So it's really hard to do, but try to keep yourself as zen as possible. Try to make sure you're focusing on positive as much as possible because that really does help. All right. We have another question. Should I be worried about the second pregnancy if I am Rh negative? So this one's kind of interesting. Rh negative refers to a person who has a negative blood type. They're rhesus factor negative. And so there's positive and negative blood types. And if you have an incompatibility with your baby, meaning the baby is positive and you are negative, and baby can be positive because baby could get positive blood from dad, okay? If that happens, your body may view the baby as a foreign object and attack the baby with antibodies, which could cause miscarriage or preterm labor. What we do to prevent that is we give the shot Rogam. And Rogam is a medication that gives you treatment to prevent your body from doing this. What should happen is after every miscarriage or delivery, if you're Rh negative and they determine the baby is Rh positive, or if you cannot determine, like if you have an early miscarriage, mom should be given Rogam. Therefore, to prevent any issues in any subsequent pregnancies, like this one, a second pregnancy. So as long as you've received Rogam, no, there's no reason for you to worry. And your healthcare provider will monitor everything. Vaginal discharge. I have phlegm, like brownish discharge, during 3 months of pregnancy. What could this be? So phlegm, I am assuming she's referring to like a thick mucousy type of discharge, and she's calling it brown. So brownish discharge usually indicates bleeding, okay? And bleeding is not good during pregnancy, especially during month three. So you need to make sure you are contacting your healthcare provider and letting them know what's going on. You never want to ignore brown discharge. However, brown discharge, especially a thick phlegm-like discharge, could also be the sign of an infection. So infections occur for a variety of reasons. Some can be caused by normal vaginal bacteria, and some can be caused by sexually transmitted diseases. So you want to go ahead and have your healthcare provider swab you so they can send that sample to the lab and determine what kind of discharge that is. So what does a swab look like? A swab is a cotton tip applicator. It's usually very long, and the end is a cotton, and it's sterile. And they have you lay back, and they will insert that applicator into the vagina to collect a little sample and send it off to a lab. Now, one of the things women don't realize is that a lot of times this has to be done with a speculum. So a speculum is a device. It's usually either plastic or metal. It goes into the vagina and it opens so that we can see inside. Okay. Once we can see the end of the cervix, we look for that discharge and we swab it. But unfortunately, what a lot of women don't realize is that in order to collect that sample properly, we are unable to use any type of lubrication on the device that can make this comfortable. And as a result, this procedure can be very uncomfortable. And I say this not to scare you. It's very important for us to collect this. But I think oftentimes this isn't explained to women who, after the fact, don't realize that this was done the right way. So if you have to go into your healthcare provider and they need to do an exam, ask them, say, is this expected to hurt? What am I going to feel? That way you know what to expect and it's a little less scary that way. I also want you to know that so you know that if that's what happens, generally speaking, that means that they're collecting the sample right, because a whole bunch of extra stuff on the outside can actually mess up the sample and give us a false result. All right. And just remember, for any of you guys joining us, please feel free to type any questions into the chat, okay? Yeast infections. I am 22 weeks pregnant. My doctor prescribed 3 fluconazole tablets once in a week. Is it safe? Other suppositories didn't work for me. The answer is yes, it is safe, okay? And actually, the only thing I would say is this may not actually be enough. So unfortunately, you're going to have to see if that treats the infection and it goes away. If it doesn't, you actually may need to repeat that at a higher dose. Yeast infections are a common type of infection that happens during pregnancy. So it's often characterized by itching and burning in the vaginal area, and it includes a discharge that often looks chunky, kind of like white cottage cheese, okay? Yeast infections are a big deal. So women are used to getting yeast infections, and oftentimes we just treat them on our own. There are tons of over-the-counter products that you can get, and you just do it. You can't do that during pregnancy, okay? There are other types of infections that can have similar discharge and symptoms. So you want to make sure that you know this is yeast versus bacteria. But then second to that, you want to make sure that your healthcare provider has decided how they want you to administer the medication. So this person mentioned suppositories, which is totally valid, and your provider may say use a suppository. For those of you who don't know, a suppository is like a little round bead and you stick it into the vagina. But when you stick something into the vagina, you have to be worried that you may introduce infection. So some providers would rather you use a cream or instead an oral pill like this person describes. But yes, the bottom line is fluconazole is okay. I see we have a couple questions in the chat. Hi, I'm watching from the Philippines. Hi, Abby. I have questions. Which one should I follow, my ultrasound or my last menstrual period? Because in my ultrasound, I'm 10 weeks, 4 days. My last menstrual period, I'm 12 weeks and 4 days. Okay. So it's hard to say. This is terrible. Usually we go with LMP. Okay. Ultrasound can be off by up to a pound later on during your pregnancy. Okay. So unfortunately, you probably actually got pregnant somewhere in between there. Okay. You actually probably are about 11 weeks, 4 days. The reason why we go with the LMP is because that's the most definitive date that we have from you. We know that you were bleeding on that date. Ultrasound will actually become more accurate as the pregnancy progresses. So you may find that they will actually start to line up together towards the middle of your pregnancy. Now, if it never does, they may decide to go with your ultrasound date if the ultrasound continues to match itself throughout. When you get to like the anatomy scan, one of the things that they're going to do is they're going to measure some of the bones of the baby, and they measure that length and they compare it to the gestational age to determine if the baby is growing properly. So if they find that the baby is, for example, larger than gestational age, that would match your LMP and they may decide to go with it. Hey, this is from Shoshana. I hope I'm saying your name right. I have severe anxiety and I've been on Effexor for a couple months. I'm 3 months pregnant. Should I be worried? I've been taking the medication since I got pregnant and I'm kind of worried. Okay, so this is a great question. And one of the things that I'm doing right now as I'm going to answer this question is I'm looking up Effexor. So one of the things healthcare providers should have when they're educating you on your medications is access to medication guides for pregnant women. Now, before I address this, one of the things that's been proven is that untreated anxiety and depression have their own risk factors. You can actually have miscarriage, a small for gestational age baby, poor placental flow, higher risk of infections, all from untreated anxiety and depression. So one of the things you need to know is that ultimately it can be in the mom and baby's best interest to treat, even if the medication is known to have risks. Okay? There are moms, for example, who stay on lithium throughout their pregnancy because that is what controls their mood. Lithium is known to cause heart defects. And yet some women must maintain that lithium to have a ultimately more healthy pregnancy. Why do we say that? Because even though there's a risk for a heart defect, it's just that. It's a risk. If you are a regular mom with no health conditions whatsoever, just walking down the street, you have a 2 to 5% chance of developing a spontaneous birth defect. So a lot of these medications, they may have risks, but those risks are almost equivalent to the regular person walking down the street, which is why sometimes it's better to take the medication than not. So in the case of Effexor, okay, so Effexor, what it is saying about Effexor is this. Effexor has no greater increased risk of a congenital defect more than the regular person. But what it does say is Effexor may lead to something called withdrawal syndrome at the end of pregnancy when the baby is born. So what is withdrawal syndrome? Sounds scary. It's not really scary. Withdrawal syndrome is when you deliver the baby is no longer getting little tiny bits of Effexor through the placenta and therefore notices that change. The treatment for that is to breastfeed if you can. Additionally, that withdrawal syndrome, it doesn't include seizures, it doesn't include anything like that. And eventually, within a couple days, the baby will resolve on its own. Okay. But definitely keep with your healthcare provider on this. Mm-hmm. Next question is coming from Tahari. Does consuming the placenta actually give health benefits? Okay. So right now, the answer according to the research is no. Okay. There is no actual study yet that shows that doing this is actually going to help you. What I will tell you is I am at this point against this practice, and this is the reason why. There was a case where a baby was admitted to a neonatal ICU after delivery because the baby was experiencing complications. On admission, they drew the baby's blood to check for infection. Baby had no infection. 5 days later, the baby started getting worse. They tested the baby's blood again, and the baby was showing signs of a massive GBS infection. We have a link for GBS video in the chat. And the baby they couldn't figure out where the baby had gotten it from. The only thing they could figure out was mom was bringing in breast milk. So they tested her breast milk, and her breast milk tested positive for GBS. It was later found out that she had been consuming her placenta and she had had a GBS infection, which she did not know about. GBS is a natural bacteria found in the vagina and the anal area. It's not a sexually transmitted disease, it's just there. Because of that, it had transmitted through the breast milk and the baby got very sick. Luckily, the baby was fine. They treated the baby. But this is a very good example of why this practice needs to be done very carefully, and it needs to be done if it's evidence-based.
Abby, second question.
Abby, I see you have a second question. What does it mean, no cul-de-sac fluid in my ultrasound? I don't know what that means, meaning I don't know the term cul-de-sac. The only thing I can think that they're saying to you is that there's no fluid in the sac, but they might just not see the fluid yet. I'm not 100% sure based off of that question, Abby. Let me know if you can reword it. We have a 3-day-old newborn who cries often, even if she is well fed and sleeps well, and only calms down with use of the pacifier. Is it a good idea to continue the pacifier or look for alternatives? I love this question. So, pacifier use is recommended by the American Academy of Pediatrics once breastfeeding is established because it reduces the risk of SIDS, which is sudden infant death syndrome. So we have a video on pacifier use. We'll link that in the description or in the chat, but pacifier use is absolutely recommended. However, I am concerned that the baby is not eating well, okay? So babies should be eating for 20 to 30 minutes. They should be coming off the breast naturally on their own, and they should be able to sleep for 2 to 3 hours. The baby should be having 8 to 12 wet diapers and 6 to 8 dirty diapers by day 3. Now, if the baby is not doing that yet, don't despair, just keep breastfeeding, because my guess is your milk is almost there, but not quite there yet. The pacifier could be just a self-soothing mechanism also. I mean, if you're getting all those dirty and wet diapers, the baby's growing, everything else looks good, you're seeing milk dribble out of the mouth and all those things that tell us the baby's doing well, your baby might just like to suck and might have done a lot of thumb sucking in the womb, and that's why they need it. As long as baby's doing well with the breastfeeding or bottle feeding, you can absolutely continue. Zaldi, I'm 19 weeks pregnant and I feel uncomfortable during my pregnancy. I feel so much heat during the night. Isn't it normal? Is it normal to feel this during pregnancy? Absolutely, it's normal, Zaldi. I am so sorry you feel this way. You're growing a human being. And when you're growing a human being, all of your organ systems are working differently and they are working hard. In addition, you have a lot more blood flow and your heart is working overtime to help provide your baby everything it needs. This produces a lot of heat. So a lot of women do experience this. What I will tell you is do your best. Wear lighter clothes when you go to bed at night. Maybe grab a cold compress to put around your neck. Remember, we hold on to a lot of heat in our extremities. So keeping your head uncovered, your hands uncovered, and your feet uncovered can help with that. Try to use a fan to move the air and then just do your best. Unfortunately, this may last to the end. Abby, my doctor gave me dydrogesterone 2 times a day for 1 week because my stomach sometimes feels hard. I'm guessing you're asking if that's okay. So I'm not familiar with that exact hormone, but I believe that hormone is very similar to progesterone used here in the US. The hard in the stomach sounds like contractions. Yes, that would be used for contractions. I cannot specifically say that one is safe, but I'm guessing it is. You could ask also your local pharmacist. All right. And Tahari, how long is it okay for the baby to cry? Would rather not use a pacifier to quiet her. So, it's okay. It depends on how old the baby is. Basically, newborns to like 2 months of age, you don't want them to cry a lot. they are completely helpless at that point. Maybe 5 minutes or less, but really you need to be addressing the need, whatever they're asking for, and it can be difficult to find. You need to try to address it. Remember, it's very scary to be outside of the belly. So baby may be sucking for comfort because they don't know anything but your belly and when they come out. And this place is loud, it's hot, it's cold, there's touches, there's smells, and baby needs to get used to all of that. So you want to make sure that you go ahead, and I want you to take a look at the pacifier video, because that pacifier video will give you more help. But pacifiers are actually recommended. Okay, they help with SIDS. Okay. And I think that that's just about it. If I want to thank all of you for coming tonight and joining us on our live. These were great questions and great answers. Remember, we're trying to do this here every Monday night at 9 p.m. Eastern Standard Time here in the United States. We are putting out videos weekly. We have another video coming out tomorrow. So please go to the channel. I want you to hit the subscribe button and the notifications so you see our latest stuff. And remember to like all of my videos and put any questions in the comments, okay? Thank you so much for joining us. I'm Dr. Samantha, the maternity mentor. Have a good night, guys. Bye.